Ingrown hairs used to be the absolute bane of my existence. If you have thick hair, curly hair, you know what I'm talking about. I have gotten laser hair removal, and so I actually don't even have that issue anymore. But if you haven't gotten that yet and you want some at-home treatment options that you can do to prevent and treat, let's break it down. I'm Jordan Harper, board certified nurse practitioner. I have been in the medical field for over a decade. I have a skincare brand called Bareface, and I believe in the philosophy of less but better. So let's break down ingrown hairs and how you can prevent them, how you can treat them, and the number one tool in the toolbox to hopefully never get one again. So what happens is when the hair grows back, it either starts to curl or grow sideways, thus leading to an ingrown hair. And that causes redness, inflammation, sensitivity. And they just tend to be in the areas that we just, they're just not comfortable. There are 4 causes of ingrown hairs, and some of them you have control over and some of them you don't. The first is coarse or thick or curly hair. This is just more genetic, and those are just kind of the cards you're dealt. The other 3 are wearing tight clothing, an accumulation of dead skin cells on the surface of the skin, and improper shaving techniques. So let's get into the ones that you can control so you can minimize the ingrown hairs. Shaving techniques. This is where if you have darker or thicker, coarser hair, you have to shave more frequently, and it's pretty annoying, and you're also more prone to razor burn. There are some tips that you can use before shaving to actually give your skin to soften the hair, and it will make your post shave a lot more enjoyable. Let's break that down first, and then let's talk about the shaving techniques. Before you're even going to attempt to shave anywhere, you need to exfoliate, and you need to do that for a number of reasons. One, the accumulation of dead skin cells on the surface of the skin will actually trap the hair from growing through, and which is why if you have a lot of dead skin, you're more prone to ingrown hair. There are so many benefits in exfoliation, and honestly, the key to good skin in general, not just on the face, but on the body, is the balance of hydration and exfoliation. So exfoliation is kind of your key, and especially on the body because the cellular turnover is slower. So you're just more prone to dead skin cells accumulating on the skin surface. Now, this is also what you can see on the back of the arms and other areas of the body called KP, and regular exfoliation can also help benefit with that. So they all kind of go hand in hand. You're not going to regret exfoliating the body. Proper exfoliation not only is going to remove those dead skin cells, it can also lift the hair and help soften the hair before you shave so that you're going to be less likely to cause sensitivity, irritation, and ingrown hairs post-shave. So exfoliation is great. I like to use both physical and chemical exfoliants on the body, and this is a little bit different than what I typically recommend for the face, where I do not like a physical exfoliant. So here's what I like to do. I like to use a high percentage of glycolic acid. I love our glow peel pads for this. These can be used on the face and body. On the body, you need to exfoliate more regularly. The skin is more resilient. It needs more exfoliation than on the face. And so these can be used daily on the face. And typically a high percentage exfoliator can be used daily on the body. I use that pre-shower, and then I also dry brush. So I dry brush my full body, starting at the bottom, going up. I use slow motions. I kind of do some circular motions over the joints, circular motions over the abdomen. I really get into the back area, which honestly just feels so good too, because it just feels like a little back massage. It feels like a little back scratch. I love a dry brush moment, and I do both of those things pre-shower. Then when I get in the shower, I'm not going to just start shaving right away. I want to let the hairs kind of soften. And this is again going to minimize the sensitivity post-shave. What I'll do is maybe wash my hair first, or I'll give it at least 3 minutes before I start to shave to help soften the hair. Then what you shave with and how you shave is equally as important. What you shave with, try a conditioner. Think about, again, softening the hair. So conditioner is not just for the hair in your head. You want to soften the hair on your body. By softening these hairs on the body, you're going to help prevent ingrown hairs. Now, the way you shave and what you shave with, also equally as important. So you want to make sure that the razor is sharp. You do not want a dull razor. That's going to cause more irritation. You want a sharp razor, and if you have done all the pre-tips, you can go ahead, shave upwards. If you are extremely prone to ingrown hairs, I would shave with the direction of the hair instead of the opposite direction. This is obviously not ideal because you're not getting that close of a shave, but it's going to prevent the ingrown hairs, which you got to choose what you care about more. This would only be if you're extremely prone to ingrown hairs. I would shave with the direction. So on your legs, instead of shaving up, I would shave down. But hopefully all the other tips with the exfoliation, with sitting in the shower, with softening the hair, you have eliminated a lot of that, and you can just have an upward shave. Next, you want to keep a moisturizer in the shower. This is really important. Having a moisturizer in your shower is actually like a little hack that I love. And you can also do this with a body oil, either one. If you use a body oil, this is really important. A body oil itself is not hydrating. So making sure the skin has a little bit of dampness to it before you apply will actually lock in the hydration. Or if you have a moisturizer, you just want to pat your skin dry and then apply it while your skin is still relatively damp. Because your skin is going to absorb it better, it's going to be more hydrated, and hydrated skin is more flexible and it's more supple. So also less likelihood of a hair growing inward with hydrated skin. Okay, so you've gotten out of the shower, you're hydrated, you're moisturized, and now you want to get dressed. The key is avoiding tight-fitting clothing because this is going to potentially cause friction and irritation, which can lead a hair to grow inward. Just some loose-fitting clothing initially afterwards for the first couple hours. These are all things that you can do at home with relatively minimal cost. Now, if we're talking about additional treatments that you can do at home, there are at-home laser hair removal devices. I would say if you have more fine, thinner hair, this can be a great option. I've used this on my legs and I've seen really great results. But if you have more coarse, thick hair, a more permanent hair removal option is great. And truly it's hair reduction because the hair is always going to potentially grow back in some capacity. That's when you could go into an office and get a true series of laser hair removal treatments done. And depending on your hair quality and depending on the area, it's quite a lot of treatments. And if you're even thinking about it, this is a great time of year to kind of start it up because you have to do the treatments along the cycle of the hair growth. And so you're doing them once every, depending on the area, maybe once every 4 to 8 weeks. And if you need 10 plus treatments, by this time next year, you'll be ready for next summer. So this is a great time to jump in if you are looking to do laser hair removal. The nice thing about laser hair removal is even if it doesn't completely get rid of the hair, it significantly thins the hair. And so the likelihood of ingrown hairs is very, very little. It's not that there's no hair growing. It's just so thin that it's very, very easy to manage. Prevention is obviously the ideal scenario. You want to prevent them instead of treat them with everything. Prevention is better than treating. You're just going to have a better result. But the thing is, it doesn't always work out that way. And maybe you're in the point where you have an ingrown hair and you're like, how do I treat it? When you have the ingrown hair, you still want to rely on exfoliation. But the caveat is you want to skip your physical exfoliation because you don't want to further aggravate that area. Chemical exfoliation, like the glow peel pads I was talking about earlier, are great in this scenario as well because they're going to help break down some of those dead skin cells, release the trapped hair. And so exfoliation is your friend. Just skip the physical exfoliation if you have an existing ingrown hair. Next, if it's a little bit painful, just applying a warm compress can be really helpful. You could do that a couple times a day, and this is going to soften the area and hopefully bring the hair to the surface. There's 3 additional topical treatments that can be beneficial when you are treating an active ingrown hair situation. Anything with salicylic and glycolic acid that's going to help promote cellular turnover and decrease some of the inflammation. Benzoyl peroxide can be helpful to reduce redness and hopefully prevent infection to the surrounding area. And third is hydrocortisone. This is something you want to use sparingly, but if you've got some really inflamed, painful area, this is a great tool to have in your toolbox to put it on a couple times a day. I would say no more 5 consecutive days, hopefully less than that, and twice a day. And then after that, you just don't want to be consistently relying on steroids or applying steroids to the skin. But this is a great tool, especially if there's a lot of sensitivity, pain, and inflammation. You do, as hard as it may be, want to risk picking at the area. Now, if the hair is close and you can manually extract it with some tweezers, great, go ahead and pull it out. You want to resist the temptation to dig in there and try to get it because you're just going to have scarring, and then the area is going to have post-inflammatory erythema, and it's just going to be a mark there that you're just like, why? So if you can avoid that and use those other treatment options I mentioned first to bring the hair to the surface, then pluck it out when it's ready, you're going to have a lot less post-inflammatory erythema and hyperpigmentation potentially down the line. Typically, you're not going to need to see a doctor for an ingrown hair. If it does get infected, like showing signs of pus, you could go visit your dermatologist. Hard to get in, but I would say if you have chronic ingrown hairs, the best thing you can do is look into laser hair removal. I know I've said it once, I'll say it again. It's one of my favorite things I have ever done because, again, this was like becoming the bane of my existence. And if you live in a place where you are outside a lot or in your bathing suit a lot, it's extremely embarrassing. You feel like you're restricted in the things that you can wear and the things that you can do. And so I highly recommend it. I've had nothing but a great experience. Ingrown hair treatment is frustrating, but there are very effective ways to minimize it so you never have to deal with it again. Laser hair removal being the number one. Hopefully I covered everything you could even imagine. Maybe you didn't even want to know about ingrown hairs. Questions? Drop them below.